5 o'clock, we will call the City of Hudson Public Safety meeting to order here on October 5th, 2021. Roll call, please.
Alderperson Holmes.
Here.
Paul.
Here.
Morset.
Here. Approval of the August 5th, 2021 regular minutes. Any corrections or revisions?
Move to approve.
Second.
Any further discussion? Seeing none, all in favor?
Aye.
All opposed? Motion carries. New business, blind child sign. This issue was, well, Jeff, you wanna?
No, I think, was this yours?
Yeah, a resident up in the new Atwood, Elizabeth Way development has a child that is going macular degenerate, blind in both eyes. So they had requested that a caution sign, blind child sign, I don't know, what are they called, Bill?
Caution.
Be
Blind child.
posted,
Mhm.
be posted up there. So I would recommend, because of the speeding, and yet there's still a lot of construction work up there going in and out. So both ways probably, I don't know how it's set up in your neighborhood.
It is set up both ways, one on either side of the main cross or main thoroughway on Tribute. And that brings up a really good question. Do we have standards for the placement of these?
There may be standards as far as, what's that book that Dean often references? There might be standards in there.
Okay. Do you need more direction?
I don't think so.
Versus where?
They usually, the Public Works Department will place them to the standard.
Gotcha.
And for future reference, Bill had brought a good point up earlier this afternoon, is that these signs can be replaced by or be put up by city staff. I think we approve that staff do it, so it doesn't have to come here,
Mhm.
if our recollection is
Yeah, so Mr. Reeves, our administrator, because I had asked for one and came to, or actually my wife came to one of these meetings, right? And then Aaron said that we can just do it administratively.
Right.
So,
I think the reason that it came here in the past was because of a costing thing. There was a costing issue of who was gonna pay for the sign, and in developments with associations, the association generally would pay for the sign to be put up so that
got it,
the private roads and the associations will put those up,
got it.
so.
But this
So-
is gonna be paid for by the city?
Yeah, I don't know of any association in that development yet.
Yeah, at this point, yes.
I'll make the motion unless you,
Go ahead.
you made the recommendation
Go
earlier,
ahead.
but I'll make the motion to install blind child signs going in either direction on Elizabeth Way.
I'll second.
Any further discussion or concerns? Seeing none, all in favor?
Aye.
All opposed, motion carries. I do want to say one thing I forgot to say in the beginning of the meeting. Councilmember Alms will take over at 5:45 because I have to go and chair Plan Commission tonight. So I do also want to put the number C, dispatch, and review dispatching operations ahead of the case manager position because Terry and the officer are here to discuss that. John, you ready then?
Yep.
Okay. So we will talk about the dispatch and Lakeview dispatching operations. I had requested this some time ago, that we look at this because it was one more last piece and it was never an attempt to offend the dispatch or the sheriff's department. But since we had funds coming in from the federal government on the pandemic monies, is that I thought this would be a good place to put an investment of $100,000 for that piece of equipment to offset any cost to the county or the city, since we're getting the money. So that's why I brought it up, if it would help reduce times on response times and what have you. That is my whole premise, is to save lives. Now, I'm not saying it's not going on up at the county or whatnot, but that's where I'm at.
I can summarize some of that too, and
I sent you guys out a document at your request, Mr. Chair. You asked for just some bullet points on some of the issues. And I put other detail in there, but I'll just kind of address some of the major issues that could occur in the way the process works today. So in the event that we were out of ambulances and needing mutual aid, because of the process that occurs today in the county, where they tone the ambulance out on the county pager system, and then there's a retone, and then once they get a determinant code, I think I'm saying that right, then the call goes into our dispatch center. So, you know, those delays could be 30 seconds, could be 2 minutes, I don't know, you know. But in those situations where we don't have an ambulance here, we want to get an ambulance started from one of our mutual aid partners as quick as we can. That, to me, is one of the biggest risks. And then the second bullet point is our backup coverage. So whenever we deplete our resources over here in the county, we immediately, when that ambulance is paged on the call, then another ambulance is moved over here to cover the community. So again, the longer that delay is, we run the risk of having a longer response to get over here. And there's a lot of other things on there, the mapping, the crews, you know, we pay a lot of money for the dispatching that we get from a line of transportation, and the technology is top notch. And the technology is there to get our crews to the scene as safe as they can, as fast as they can, and taking the best route. And when our dispatch center doesn't have the ability to enter that into the CAD system, our crews essentially are going to that call blind. And what happens today is they're using their personal phones to enter the address in to map to the call. So, you know, that's not efficient, that's not what we want our crews doing. But that's the way the county has operated over here. It's not faulting what they do, it's just, it delays what we could be offering and doing. Now, we don't really have a delay because our crews respond when that pager goes off. But our data doesn't show that. Our data is showing our times. So essentially, our times look better. We're still under the what our contract agreement is, but I think you guys would want to see what the real times are, and that's we can't do that without having our dispatch get notified. So then, I won't go through all the bullet points, but then the number one goal here, I think, has always been knowing that the county was going to be upgrading their CAD system in the county. We knew then that the technology would be there eventually to be able to push the data from CAD to CAD. And that is really what we've all been waiting for and hoping for. But I think none of us really realized what the cost of that was going to be. And I think the county has more detail than I do on that. But that's really what we'd like to see. That's going to benefit the county, number one. It's going to benefit both sides because the data that the counties get on the 911 system pushes right into our CAD system. So there's no, you know, the old telephone tag where you tell one person and they tell someone. There's opportunities for errors to happen. Where the data's all going. And then, you know, if that doesn't work out and we can't do that, we would like to request the county to call our dispatch first to get that call logged into our CAD system and then set the pagers off. So that's kind of summarizing our end of it. And I don't know.
Terry, if you wanna, I have to have you come up by this microphone if you don't mind, or hate to put you on the spot, but we are. And just introduce yourself and your address for the record, please.
My name is Terry Anderson. I'm the Emergency Communications Manager for St. Croix County. So, through all this process, when we updated our CAD, we were at the table with Alina asking them if they'd be willing to upgrade to the CAD to CAD. There was funding back just over a year ago that we had in this project, and through this year we've had it as well. As far as I know, I don't know if the funding wasn't available for the Alina side to do their half of it or not. I'm not gonna speak for them or not. The CAD to CAD would allow Alina to see basically real live updates. And would share information back and forth that we'd see the vehicles, and of course, kind of the sky's the limit on what we'd be able to see. Right now, what John said, we tone out Lakeview right away, just like we do for any other agency. That includes the fire department if there's an accident with injury, notify law enforcement in the city immediately of it and get them responding, and then make the phone call. Most times it's before they're done processing the EMD through the protocol, because that does take a time going through gathering the appropriate information for John and his staff to respond emergent or non-emergent, so it's done safely. Some of the times in John's document that he provided, there's some that look like they're way out of whack, they're long periods. Them are times where law enforcement, I went back and looked this afternoon, law enforcement was on scene for a while. It was originally a police department matter, and then requested EMS to respond. So some of them numbers, if you're thinking they look way bad, they're not really. Questions?
And we did explain that too, Terry, just in your defense, that, what I had said to the committee here is that, this doesn't tell the full picture. It was basically, we were gonna look at 3 months of data, and after I got through with 1 month and went to the second month and it was looking exactly the same, I thought, I don't think we need to do all this work. 1 month kind of shows us the true picture of it, but in a sense it doesn't, because we don't know what's happening on the other side of that call.
So is this equipment or software or both that we're talking about?
It's a software, but it's all, the latest quote is cloud hosted between us and Alina.
Mm-hmm.
And the software would have to be programmed up on both sides for it to work properly. And then, of course, we have to decide that there's multiple levels of information that's shared, and to come to an agreement on what is shared back and forth, or what needs to be shared
Mhm.
back and forth.
And what are the costs, the total costs for this on
For our
each side?
side, I believe the last quote that was within the last 2 months, it was about $35,000 for the initial. And then there's a yearly maintenance fee, and I believe that's around $15,000. And I can't say what the Alina side is.
John, do you know?
I don't. I talked to Angie Fox, I think she's interim director, maybe she's full-time director now for Alina Communications. And of course, they want the system, it benefits them, because then they know that they're getting the accurate information right away. But the issues that all of us in healthcare are having is, with COVID, everyone's capital budgets have been frozen. So a year ago, I think it was a year ago when we originally started talking about it, it was in the ballpark of $100,000. And she told me right away that there's no way we're gonna get this approved. Our capital's all been frozen. Ours is the same, her capital was frozen. And her argument, well, she doesn't have an argument to her administration, because in all the 80 different communities that they provide dispatching for in the Twin Cities, that cost has been paid for by all of the counties. So they've never had to pay for it themselves to get that system in place. So of course their finance department wouldn't approve it. So when I did meet with Terry earlier this week, And the price has come down from what that 100,000 was, and Terry just told you what it was. So I had asked her if that had changed anything, and she said they're still on a budget freeze, at least through 2022.
So the 100,000 is gone. It's 35 for a startup and 15 yearly.
For the St. Croix share of it. yes.
Right. And is that something you budgeted for, or we would have to go back, or?
I don't believe right now, is there any properly in that project money for that?
No, my name is Brent Standard. I'm a captain for the sheriff's office. I oversee the dispatch center and some other departments within the sheriff's office. That money, we're at the end of our capital cycle for this project, and the money is in effect gone. So we don't have that budgeted. It's my understanding that the $35,000 price tag that Terry was talking about for the St. Croix County side is about the same on the Alina side. There's an implementation fee, and then there's yearly maintenance after that.
Is there any point that you are sitting in the same room with Alina? I mean, we've been talking about this, we've been kind of meandering about the solution for quite some time. Is there something that could be a solution where we can sit down with Alina? And I get that they're on a budget freeze,
Well,
but
and I think and the whole COVID thing kind of put everyone in a tailspin on all of our operations. So, there's many things that we should be buying that we can't be buying because of it. So, that's really why it's got to this point where we can't do it, so we're not gonna talk about it.
You got a capital freeze, but would you be able to, is it financing for a yearly maintenance?
Yeah, the
fee?
maintenance fee, I don't know how that works. Typically, when we, you guys probably have tons of different maintenance fees
Mhm.
in your operation, just like we do too with our electronic charting system. And every little thing they do for you, there's a maintenance fee annually for it. And I'm sure you would build that into your operation.
Mhm. We would have to. And, obviously, we can't tie up your budget. That's not our purview, but is this something you guys want?
Yeah, I think the county's willing or wants to do it. Would be the best thing for both sides.
And do you think you could get it financed in the next cycle?
The budget's pretty much set
You have
already.
2 years?
We do 1 year at a time.
Well, that's a good thing, but I know that since there's money sitting somewhere, the government likes to spend it. And that I don't like that, but if we could earmark something, that would be ideal. But then there's a yearly cost that we would split with you, or would you take that yourselves?
Again, I think we need to sit down at the table and decide who's doing what share. And, for me, my budget's no different than Alina. Well, my budget's a lot different than Alina. Theirs is a lot bigger than mine. But we're in the same boat. I mean, we're doing essential equipment only.
Yeah.
And I don't see that changing. I mean, we just did 2022 budgets, and everything is the same as 2020. It's only essential, and then it gets approved by the corporate level, which normally doesn't really happen. And I don't see that changing. I think probably even into 2023, we'll be doing our budgets. We're gonna be held to the same standards till things start to catch back up again. On all those capital improvements or investments, I have to prove what the need is for that. And really for us, it's not affecting our response. It could. The issues that I addressed on here could happen, but we still respond when the pager goes off. The data's not gonna be accurate until we get the call, and that's just the way the system works, and there's really not a way we can change that.
Can I ask a question, Randy?
Yeah.
if you have a backup truck in Stillwater, both Hudson trucks are out, right? And you're gonna call your backup truck. Do they have pagers? Are they
No.
getting notified right away?
No. So, the only crews that are wearing the pagers are the two crews that are on duty over here. And not both medics are wearing them. I mean, you're carrying all the other stuff on your belt,
Yeah,
and
no,
we're
I hear
carrying
ya.
2 radios now, and you can't add a pager to everyone in the operation, so that's the other issue.
So it's potentially causing a life safety issue,
Well, it could.
if
I
it
mean,
gets to that max.
It could delay, I mean, it would delay the response. And it's probably no more of a delay than you have in any of your other systems unless there's a predetermined plan, which there probably is, but I can't speak for that. If you have mutual aid agreements already set in the CAD and dispatch can just push a button and do it, but sometimes they gotta ask the service or they page that service out and need to know who they should send. So the delays could be equal on either side, but
Sounds like we're gonna have to have you and dispatch, and, I don't know, county finance and lawyers get together and talk about what is ideal, how to come up with a package that is fair to everybody. I just want Terry and Brett, you guys to know that I only brought this up to make it better. There was never anything against what the county was doing or what Lakeview was doing, but how can we make it better?
Yeah, I don't think the notification to Lakeview is being done. And John's right, his crews are responding. Can it be better? We can always improve on something.
Wouldn't it take an extra step out of what your dispatchers are doing?
It would. We would not have to pick up the phone and call them.
And that's important, I think. I think.
and I think that's the reason in the Twin Cities, that's why all the counties are doing it, because it's again, Alina does dispatching for 80 different cities in the Twin Cities, and multiple counties. I don't know how many counties 911 systems they work with, but that's how all of them submit their data in. And the reason they did it is they eliminate that phone call. And they eliminate the errors that go along with that, so.
Okay, well, I think we need a little more discussion. What would you guys need? Something more concrete, obviously, and it sounds like we're gonna be pushing this off at least a year.
It's all about the other half, when they can move forward with the project or get funding for that.
Our half, Lakeview's half.
Lakeview's half, and right now, yeah, it's not in the budget for next year for us.
So I would just make the suggestion that we attempt to call a meeting between the city of Hudson, the county, the dispatch center, and Lakeview Alina. Get all 4 entities in a room together and see where we can go with the project, funding,
Okay.
and what the different avenues look like for each party.
Sure.
So we're supportive of the project and think we can make it happen.
I'm not trying to interrupt or butt in here, Captain, but one thing you may want to look at too is it's not just the city, it's Somerset, all the other municipalities that served. To me, it would be a good idea to have them in because it serves all of them and would better it for all of them. And if it ends up where everybody has to have a little stake, it may be easier, but I think maybe my suggestion would be at least reach out to the other, the village, part of Troy, I mean, you have quite a few other municipalities you service, but then again, it's not all of St. Croix County unless it's mutual aid, but maybe that would be a good place to start is get them in the room too, the ones that you cover.
Yes, but initially, I think we need to get our stuff together and then we can invite them in.
Yeah.
I think would be great. And John, I'd like to see you take a point
Yeah,
to start that ball rolling.
I'll do that. We'll get something set up.
Share it with you guys. All right.
I had one more question,
Yeah,
just to
Bill.
understand the finances. Is that something that Lakeview has to do on your end from a technology standpoint? Is it something that the county has to do, something that Alina Dispatch has
No,
to do, and then Lakeview has to do?
It would be on the Alina side, Alina and county side. It has nothing to do with what we do.
Okay, I was just
and-
misunderstanding that for a minute, so.
It's just, to be honest with you, the amount of money that we pay annually for that service, I'm not gonna be able to pull 1 cent out to add to that. We're paying a lot of money for it.
Well, it's something we'll
So,
look at once
Yeah.
we see that figure.
Yeah,
I just wanted to make sure that it wasn't anything that, outfitting ambulances
Yeah.
with a secondary thing.
no,
How many other communities would benefit from this besides, okay, so Hudson, North Hudson, town of Troy,
Warren,
Warren, yeah,
St. Joe's,
St. Joe's,
town of Somerset,
okay.
village of Somerset, Burkhart.
Mhm.
I think I got them all.
Okay. So that's 9 different entities.
Yeah.
Well, let's start that ball rolling
Yeah.
with you, John, and hopefully we can, within a month or so,
Oh, yeah, we'll get something going
get
as
us
soon as
all
we can.
together.
And, all of us are, our budgets are done now for 2022 and,
Ours is not.
okay. So
Are there
we'll
any,
get something going.
are there any grants available to get something like this going?
Well, there's different foundations that offer grants.
Mhm.
I was kind of thinking that too, but, yeah, I'm sure there's things out there that you could maybe tap into. I don't know how that works on the government side of things, if you can accept grant funding. I don't know if it's something where we could accept the grant dollars and then transfer them to the county. I don't know.
It has to be particular designated funds too, but the government entity can take it. We just approved grants last night,
Okay,
matching,
sure.
so.
Maybe
that's-
the Bremer Foundation might be a good place to look at,
Yeah,
because they like the public-private partnerships.
sure.
So John, let's work on that, and then we'll include you guys, and I appreciate you taking the time out of your evening to come chat with us. Let's work together, hopefully we make it happen. Thanks, Terry.
Thank you.
Thanks, you guys.
We're gonna keep jumping here. I wanna get Tori out of the way. Number D, Halloween on 3rd Street. Jeff, any issues
Yeah, we have an additional request from the church.
with, what's church?
Well, I printed the email off, but it went to the wrong printer. I think it's the one right on the cornerstone or something like that.
Okay,
The back with on about 3rd and 9?
Yep,
Oh, okay.
so they'd like to,
Living Vine Church.
Living Vine,
Mhm.
join in with that, and they were wondering what the odds of having the street closure start on Vine Street would be. So it'd be basically closed from Vine to St. Croix and then St. Croix to Division.
what are we fighting with, the construction?
I don't know, looks like they are, well, right now they're working on tubing and stuff underneath it, trenching with the trench winch, but
But they haven't opened from Vine to north at all?
No, it's.
oh, are you talking about the detour?
Yeah.
That's
I
looks
forgot
like it's
about the
almost
detour.
done. From my, very knowledgeable. It looks, but. it keeps
Well, no,
looking at
they're,
Vine
I mean, they haven't even started doing anything between, from Division, well, from St. Croix really to the bridge on the east side of the road yet. So, I'm anticipating another month before the construction is done.
See, this is gonna be, can you hear, Tori, do you wanna come
Yeah, I
over to
can
that, state your name and address for the record?
I forgot about the detour.
I'm Tori Boomsma at 923 3rd Street. The way the detour is right now is that it comes off of Vine Street and goes to,
Division?
No,
No, St.
St.
Croix.
Croix,
Yeah.
and then heads west to 2nd Street again. So right now, the road 3rd Street is blocked anyway from St. Croix north. There's also the route from Second Street to First Street is open. I've noticed that's a more popular detour now than coming through.
Yeah,
Third
with the
Street.
intersection of St. Croix Street being open, that detour is there. There's access to Second Street now from First Street.
Yeah,
We-
and
we-
it's,
We would have to divert that traffic to First Street if we were to approve the Third Street thing, and boy.
Well, you'd essentially close Vine Street and they'd have to go down to First Street
Okay,
to go north.
go ahead.
well, yeah, and the only reason I asked for it every year, because the first year I was there, 5 years ago, I saw a little girl run into the street right in front of my house. And it's, I don't know if any of you have been to Third Street for Halloween, it's mayhem, it's absolute mayhem. And there's cars, that year, there was cars parked up and down the street and kids were running in and out, and I'm like, I can't, my stress level is too high for this right now. And so that's why the following year I asked to have the street blocked off, because they're gonna show up regardless if we shut the street down or not. People are gonna come and trick or treat on Third Street, and that's just the way it's gonna be. And I have a feeling last year we weren't expecting as many people as we got as we did. With my one piece of candy per child, I had 1,500 pieces gone.
Wow.
So that we just, yeah, so.
Yeah, it was busy last
It
year.
was
And
really
the weather
busy
was
last
not ideal last year.
No, it was
It's cold and
windy and
windy.
chilly,
Mhm.
and so I just, for the safety of everybody on.
There is another option to, an unofficial, they can always take 4th Street down to St. Croix
Mhm.
as well. It's not that the option is completely gone.
Well, First Street's available.
First Street's available, 4th Street's available, 5th Street's available,
Right.
6th Street's available, 7th Street's available. Because St. Croix is open.
Yeah, St.
Yeah.
Croix.
Right.
Okay.
I mean,
Would,
go ahead.
Bill, you were next.
Yeah.
Oh, well, I was just gonna say, you talk about, 2 years before we started shutting it down, people are gonna do it anyway. Even, with that detour, if people are doing that, probably is even a higher risk factor.
Yeah, people aren't used to driving in a residential,
Right.
believe me, I've been paying attention to that too. People aren't used to driving in a residential street for this detour. And fortunately, it slowed down, but there was a lot of angry drivers on Third Street. Really just.
Yeah, especially initially.
Yeah, it was really bad. It was a lot of offensive driving it was really bad speeding. And I think just the unfamiliarity of people having, taking that, if they were detouring on that, it's a real big safety concern.
Everybody's listening.
Yeah.
would the state DOT have to sign off on changing the detour?
I would think, because
Probably.
that was a signed off detour.
Is it still a technical detour? It is still a detour?
Well, it's a local traffic only detour. The official detour remains Highway 95 in Minnesota
Right,
is the
okay.
official detour,
Mhm.
which is why we ran into all the issues early on with construction with the DOT, is because they didn't want to use any of their resources or signage for our local detour because that wasn't their detour.
Yeah, that was bad.
But I can talk to, what's his name, Andrew, and get that figured out.
Yeah, we better, because we gotta figure that out before we allow. I mean, you're right, they're gonna come no
Yeah,
matter
they're
what.
gonna show up.
So
Yeah.
it's better for us to close it off and be ready for it.
Should we move this to council? Would you have an answer by that point with council and?
I'll get an answer on Monday.
The 18th then. So
Okay.
we'll
We do
send
them-
this right to council.
There's a construction meeting every Monday, so I'll get the answer on Monday.
That work for you, Tara?
Yeah, that's fine.
Just work with Jeff and,
Do we need a recommendation to close off at Vine? Do we need to be specific about that, or?
let's be specific for the record in case something does happen. We addressed it and it's on record.
Move to take this to council with Chief Williams checking with DOT about closure on Third Street from Vine
From
to
Vine to St.
St. Croix?
Croix and then St. Croix north. Well, I guess they wouldn't really go, but St. Croix north. Because we left
Right.
St. Croix open last year. It
Yep.
went really well.
We leave St. Croix Street open, and we leave Vine Street open. Years previous, we left, I think, Orange Street open, and that's where we started the closure.
Yeah,
Mhm.
yes.
But that causes more headaches than anything, I think, because people are trying to get to Third Street and then they get confused because now they're kind of
Lost.
stuck in the middle of limbo on Orange Street.
Yeah.
So, to be honest with you, it's probably safer and more effective to just close it at Vine Street, and then we close off the side streets to not allow people crossing.
And then they have the explorers that patrol it too, so it helps them monitor the intersections and everything. So they're not just empty intersections, there's someone mans them too.
Was there any success with trying to keep the kids moving in one direction? No? Okay.
Nope, the delineators had zero effect.
Zero match. Nope.
Okay.
Nope. It was a great attempt, but nope.
Okay.
Was there a second?
I'll second.
Okay, Melanie, you got the motion, no? Any further discussion? Seeing none, all in favor? All opposed? Thank you.
All right,
Tori.
thank you.
Have a good night.
Thanks.
Okay, Ruth, you can jump in on this too. Hot air fair, number E.
I'm Ruth Peterson, 735 11th Street South. I am retiring from the logistics management from HOP for Hot Air Fair. I've been doing it for 20 years, and I am now passing it over to Amanda here.
You told me that 9 months ago, Bruce.
So I am done. I'm gonna be here to walk, so I walk behind Amanda for Hot Air Fair. But right now we're together, but I will be behind her, directing her in the right direction. She knows my phone number and my email address, so we're good there. So I'm gonna turn it over to Amanda, and then when we're done, if you have any questions, I'll be able to answer
So
them.
the agenda item is for regarding potential changes, and the idea is to relating to it?
Correct.
Okay.
Amanda Hine, I'm the new logistics coordinator. I got to walk behind Ruth last year, so now apparently I'm in front of her, which scares me because her shoes are bigger than mine. And my heels are sensitive. As I'm sure all of you guys are familiar with the Hudson Hot Air Fair, this year it's going to be February 4th through the 6th, which is that first weekend in February. This year's theme, we just had an announcement. If you're not already on our Facebook page, please go to our Facebook page and like it and share it. That this year's theme is S'mores and More, Balloons Galore. This is going to be a huge hit after the huge push for camping and fishing and people spending a lot more time outside because of COVID. So it's really going to be an exciting theme. As we look ahead, it's important that our event has multiple options to make sure it's successful. As we all know that our times are changing because of COVID, that we need to make sure that everybody is at their people are the front and foremost of our thoughts. So it is it's still our hope and intention. Our plan A is still to have the launch and activities at the elementary school. One of the biggest changes is that we are going to allow parking on only one side of the street surrounding the school. And so that has multiple functions, public safety for people walking because there's not a good crosswalk and situation, obviously it's the winter. We push the snow in a certain way to make sure that there's the most room for walking. But having that will also allow for emergency traffic to be able to get through both around and we all know what kind of a traffic cluster it becomes afterwards, so that will help. I mean, it spreads it back and it pushes it back a little bit, but that big cluster of all of those people leaving right after the launch is our biggest concern, to make sure everybody is the safest possible. So we do have a plan B. Last year we discussed our plan B. It's the same, so it would be a Moon Glow drive-through in the industrial park. So it would be going in Hanley, O'Neill, and coming around, and there'd be one direction leaving off Hanley the other way. So that way, and that would minimize our need for police just on each of those two intersections, and then we can do the traffic within those parameters. And then it'd be double laned. The Moon Glow only lasts for an hour, so it would allow us to be able to get the most amount of people through quickly and safely, and still be able to enjoy the event. And we would make that determination as it comes closer to the event. And same thing with the traffic parking that will be closer to the event, that we'll put out signs and notify all of the local residents. Obviously, our event is always weather dependent. Now it's weather dependent and COVID dependent as to how we do things. And so it just, we hope that this year we're blessed with amazing weather so our community can thrive and enjoy this amazing event. If you guys have any questions?
How'd you do last year with the drive-through?
It was 40 below.
We canceled it the morning.
Oh, that's right.
Yep.
Yeah, we canceled it like on Thursday.
First time in 30+ years that it's been canceled, but it was a good call. Katie Jones had spent the entire day out with food trucks collecting food donations with Thrive-In. And I was out there that whole day. I mean, you were popsicle frozen, eyelashes couldn't open and close, your mask was frozen to your face. It was a rough situation. So we were glad that we didn't have to put our volunteers and our pilots in that situation. But they did launch on Sunday morning. 2 pilots did decide to launch.
So what are you asking of us?
We just wanted to give you the information that we were looking at Plan A, which is the original hot airfare, and the Plan B, like we did last year. You know, then when we do this, the big ordinance that we will need to do, we'll put that in there. But we just wanted you guys to be aware that this is what we were looking at, Plan A and Plan B, because of the COVID
I
situation.
think it's really important that you guys did address your Plan A with the residents up there. They had a lot of parking issues and darting in and out of the kids and stuff. So that was a big issue, so it's nice that you guys addressed that.
Can I make her,
Mhm.
is there a way that if you're gonna only park on one side of the road, that the traffic flow only goes one direction during that time frame instead of, traffic going both directions? I don't know what kind of logistical nightmare that would be, Chief, but I
Yeah, that
just,
would be complex,
yeah,
cause it's
There's so
you've
many.
got
I know
13th
there's so
Street,
many
you've got
different
Summer
roads,
Street,
but-
you've got Freer and Hoyt, that you have to go pretty much one way around that whole block, well then how do you?
But I
I
think,
mean, it's possible, yeah,
But-
it's not impossible to do it.
that's where we would run into the issues, is the traffic coming the other way and you're trying to get to a call and then no one can pull over anywhere and you're all stuck there. And just my observation, if one lane was closed down and everyone was going one direction.
Yeah, I think with parking limited to one side of the street, I think you
would
can
help
still
that. Yeah,
get
it would definitely.
2 vehicles through.
Yeah,
Cause that was one of the issues that we've had in the past, especially if we get a lot of snow, right? I mean, the plows don't get all the way to the curb, right? So it starts to build out and the street's narrow in the wintertime. But now they've started to push that back inside
yeah,
on the school side, which is the parking side, and basically becomes a snow-built sidewalk
yeah.
for people to walk once they park on that side. And that should allow 2 vehicles to pass.
Yeah. Yeah,
But we
definitely do it.
I can talk to Dean and Miraz too, to find out what the street width is out there and then subtract,
Yeah.
A parking lane and see if it's adequate to allow traffic going both ways. And if it's not, we can talk about, going one way around that, or just around the school.
Right,
And we're, starting over on, by the church and taking, 13th, around all the way to Summer and
Yeah,
back. So.
it'd be one way from 13th to Freer and then Freer to Hoyt and then Hoyt back to Summer Street. It would just be a big loop,
Big loop, yeah.
okay,
which is not bad. It's not definitely impossible. It just requires
Requires a lot
Some
of
signs.
resources.
yeah,
and some time to work out a little bit of that for you
yeah.
and for the chief.
and communication, for your maps, that you send out with your information to let people know, hey, this is gonna be a one-way, right?
Yeah.
I mean, so we need to know that pretty soon, but let me get working with Dean and Mike on that and see if that's something they're amenable to.
Thanks for taking.
We also the neighborhood letter is gonna go out sooner, so we're redrafting that to make sure that we are addressing the parking issues.
That'd be good.
Along with, and then if we do decide on, one-way traffic, because we wanna include a map on there, so that way it's just a nice visual that people can go, oh, this is what the plan is, okay. And then they have a little bit more time. I mean, most of them have lived around the school for
Mhm.
a couple,
30.
a couple balloon raisings that we've had, but that we just want to make sure that everybody knows and what the expectation is. I mean, it is one day, it does get a little intense, but we just appreciate that everybody's willing to continue to have the event and help everybody out.
Thank you for taking the time to come talk to us and introducing your
You placed it.
yeah,
Protege.
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 But thank you.
Thank you guys.
Thank you guys.
Do we need a formal motion on that at all?
I don't think it's not yet. At this point, I'm gonna hand the meeting over to Bill, but I just wanna say one thing on the Higgins Street about the sirens. I don't think 7th Street is working. If that could be checked out, Chief St. Martin.
Jeff
I'll
is
check
the
it out
emergency
for you.
manager.
Since when?
I was demoted.
January of this year.
Okay. But,
Yeah, I'll get it figured out.
yeah, check 7th Street out and then I
The
think.
last test, they were all working, so,
Okay, the Hudson pursuit policy, I think I wanted to talk about that.
yeah, it was, we put it on there like as an informational thing.
If you want to express to the,
Sure.
what the policy is.
Well, the policy hasn't changed. It's basically a directive from me that they're not to chase vehicles into Minnesota.
Okay.
We don't, we've restricted our ability to chase for a variety of things, right? We've restricted that pretty well. But even if we're allowed to chase, I don't want them chasing into Minnesota because of the new law over there. If we're chasing somebody, it's going to be for something pretty violent. And the odds of that continuing to be violent is pretty good. And if our officers were to engage a violent threat in the state of Minnesota, we're held to their legal standards. And those legal standards have really changed in a way that they could handcuff us, and I'm not gonna put our guys in a position to go to prison. So that's where that came from.
Right. And feel free to talk about it. And Bill,
Thank
maybe
you.
you should slow down and stop speeding and they won't go over there.
Wow. Ouch.
Thanks,
That's the last time you pulled me over. So let's go back up in the agenda, case manager position discussion.
That is, I believe, Scott's.
Not really, but anyway, long story, short story long. A couple years ago, I read an article about a position that they created in Greenfield. I know the Greenfield fire chief fairly well. He's very progressive. I admire him, and I thought this was interesting. So I actually just sent it to the council and the city administrator. It was like 2 years ago. Somewhere along the line, they said, well, why don't you make a job description? And I don't think the job description was included, and this was a couple of years old, but so we just created a very vague job description. And really that's where it came from. I'm not necessarily advocating it, but I did think it was very interesting position, and it seemed to be working really well for them, and something a little bit out of the ordinary. Now they do EMS, and that's where a lot of these contacts are. And I don't think it would fit into the fire department here because we don't traditionally do a lot of EMS. But I think police and EMS is the right place to have this at least in, if you're even looking at it. I just thought it was interesting. Obviously, it was 2 years ago. As we all know, in the last couple of years, things have changed a little bit. And I look back at it now and I think it was that much more progressive because it was prior to a lot of the riots, a lot of the COVID, and a lot of the other things going on. And now we look at this and it's honestly it's a position that a lot of people are trying to create. But it was informational only, and I kind of kept being asked to give a little more, and that's it. So I'm not an expert. I'm basically just a conduit of information to pass on. So that was really it.
Thank you, Scott. Do you have any questions? And I know that we're just receiving it.
Yeah, well, the big question is, how many EMS calls would need follow-up, and then how many police calls would need follow-up? Historically, what have you seen?
Follow from a social services
Yes.
perspective.
Mhm.
To be honest with you, about 75% of what we deal with is mental health related,
Mm-hmm,
right?
okay.
Whether it's substance abuse or just flat out mental health, right? So, yeah, it's important.
Mhm.
There's a couple of questions that I have, a couple of just things that jump off the page at me, right? Greenfield's a city of 40,000 people, we're 15,000, right? St. Croix County social services already does this with people that we are there assessing them for mental health or substance abuse, right? They get our reports, they try to follow up. And the limitations of a position like this are people have to voluntarily take the help, right? So we could follow up with them after our contact with them and say, hey, these are the resources that are available to you in St. Croix County. Are you interested in any of those? No, I'm good, get out of here, is generally what we get. And we've had meetings with St. Croix County Social Services, and they do already do this. They have a whole team of people that follow up on these cases. I think we would have to contact St. Croix County to talk about the legalese of something like this, basically almost creating your own social services department within the city, which is within the county that already has a social services division. So I think we need to talk to them about even the complexities of that, how that would look. I saw the description mentioned a Monday through Friday type operation. Well, that's going to be completely outside the hours when something like this is utilized, unless it's just for a follow-up, right? It's generally going to be in the evening hours or on weekends that we're dealing with people that are suffering, that are in crisis. So, I mean, it's one of those things, right? For non-emergent situations. We deal with people in crisis in emergent situations. EMS is going to deal with people in crisis in emergent situations. We're usually going to be dealing with them hand in hand, but not always. Sometimes it's just us. And that's the way that the emergency detention stuff works in Wisconsin, where law enforcement has to be a part of that. An ER doctor in Minnesota can chapter somebody, well, not over here, they can't. Law enforcement has to be involved in that process. Until that changes, yeah, I mean, it makes sense for something like that to fall under the law enforcement scope. However, I come back to St. Croix County as the whole contract for mental health in our county, and they already do that follow-up.
So this is really duplicating services.
I think it's more laser focused on a specific thing. It would be great if St. Croix County created a position like this, that's all these people were responsible for, is doing follow-up intervention with these folks. But, I mean, it's gonna be limited too. I just think it's probably more effective for a county department, especially the way we're set up in Wisconsin, to be in charge of something like that, as opposed to a municipality. Just from what I read, from what I see, and from how the system works. I don't know what Greenfield has as far as access to resources, but I'm anticipate that it would be quite significantly more than what we have, considering we have to take a lot of people to Oshkosh, for treatment. So hopefully that'll change with, the 9 million coming to northwestern Wisconsin to assist with treatment facilities and beds, but they're not built yet. So until that happens. But yeah, I mean, mental health and substance abuse is what we deal with. That's the majority of what we're doing, whether people are self-medicating to deal with their own mental illness in an unhealthy way, or whether it's vice versa, right? Where the substance abuse causes mental illness, or just people are just mentally ill and they don't know enough that they need help, or don't know how to get the resources that they need until it's a breaking point, right? And that's the challenge that police, fire, and EMS face on a daily basis. There's no easy answer to it. There's not a lot of resources available to it because you can't force people to do it. And there's no money in it. So a lot of the private outfits, the hospitals specifically, aren't going to invest a lot of money into it because there's no return on their investment. So we lack nationwide, really, in our ability to deal with the issues caused from mental illness and substance abuse.
Do you have any perspective seeing this?
No, I agree with the chief on all matters. This is a scenario that's playing out throughout the country in major cities and counties, and there's some EMS systems that are looking at doing this internal. And I think the thought is, can we try and keep some of these cases out of the emergency department? Because we're overwhelming the emergency departments. And really, it all comes down to most of the mental health cases that we deal with have some kind of an underlying medical issue that needs to be addressed first. So you end up transporting them. Just, let's look at someone who's extremely intoxicated where they don't need to go into a hospital. They should go to a detox center, but yet you don't know that. And the detox centers won't take them if they're too intoxicated. They need to go to the hospital first. So I don't know, it's tough.
Yeah. And then once they can walk away from the hospital, they no longer meet the
Right.
requirements for a detoxification placement. So you're basically taking them to the hospital to sober up, and then they go.
It takes up, these cases take up a ton of resources, ton of law enforcement resources, hospital resources, but just to try and get them committed, it's tough. And in Minnesota, on almost every case that we deal with, we have law enforcement put a hold on them. And the hold doesn't guarantee anything either, because they can get to the ER and they have to be evaluated, but they can still leave on that hold. It's not a guaranteed thing that they're gonna be there for the 72-hour hold, so
Right.
it's tough.
And there's no guarantee even when, we've got documented cases that we brought people to Oshkosh for placement, and they beat us back to
Right.
Hudson.
Yeah,
They go in there, they get evaluated by a doctor right away. Oh, you're no longer suicidal.
yeah,
Off you go.
it's frustrating.
It is.
It's
tough.
really frustrating.
It's tough to deal with.
Scott, thank you for the information. I'm wondering, did you have any conversation, or has anybody had a conversation with county? Because I think that's a really good point.
I think it's an excellent point, and like, kind of getting back to it, this kind of started with just me forwarding an article
Yeah.
that did it, but
That'll teach you.
no, and really, I think it was important enough to me to pass on, whether it works or not, county, absolutely. I think the most important thing is, right now, we are talking about this and all agree, and I'm sure council members do too, the system's broken. We need to help people. If nothing else, if you talk about stuff like this and you vet it and say it's not gonna work, we're still doing our job looking and trying to help. How can we make it a little better?
Right.
I don't think there's any fix for the whole system, but if we can make a difference in a few people and we can make it a little bit better, we can make it a little bit better for the ER people, for the cops, for the citizens, we're doing our job. But to just sit there and say, well, we're waiting for someone to come up with that magic answer and they'll bring it to us, it isn't gonna happen. We have to have these discussions. And I feel we're doing our job by at least talking about it. So that's kind of where it's good, healthy discussion, and we're acknowledging the system's broke. What can we do to fix it? But I think we need to get everybody thinking the same thing. Whether it's us, it's the families of the people that have these diseases, and that everybody needs to be involved, because it's not gonna be public safety that's gonna fix it. It's gonna be a holistic approach to make it better.
And
Well, where
the
do we start?
substantive change is gotta come from the legislature.
Right.
But to try and either push them in a direction, I agree with Scott, that you start locally and maybe to a county level, and maybe you get something that takes off and it goes to another county and it goes to another county, and maybe then we can affect some change.
And I think, I'm no expert, but with COVID and isolation and more abuse, I think it's only gonna get worse. I think you guys are seeing it, we're seeing it, so,
It's worse right now. I mean,
Yeah.
we're seeing more cases, and they're violent cases. We've had multiple of our crew members assaulted. It's getting bad. We've had patients try and jump out of the ambulance going down the highway. It's every week there's a case that, okay, this is new, we're not seeing it, but it's gonna get worse. I think the hospital, Tom Borowski, the president of the hospital, Hudson Hospital, they've done some work on mental health. I think that I heard him talking to the chief at the meeting the other day, and some of their efforts have helped law enforcement keep the officers here in town where they can do the evaluation at the hospital and not have to transport them miles and miles away. And
It's been a huge,
Yeah.
huge godsend, but the grant funding for
Right.
that's run up and now it's all on the hospital.
yeah,
So-
the hospitals.
And we've been fortunate that they've stuck with that.
Yeah,
Mhm.
and I think it is a health partner initiative too. It was this year and it will be next year to do more for mental health cases, so.
Yeah, the telehealth, I don't know if you have heard about it, Joyce or Bill,
Mhm.
but it's been a lifesaver.
So I attended a gathering sponsored by the hospital about the mental health issues, and that's what they were talking about, was the grant program.
Yeah.
So how has that been implemented that's helped the city? So you're able to
So they
bypass
have-
going to Oshkosh?
Well, let's back up,
Okay,
right? So they have staffed, I think it's from 2 o'clock in the afternoon till midnight,
Yeah, I don't know. the time.
every day,
Mhm.
something like that. It's about 12 hours a day that they staff
Mhm.
telehealth representative at the hospital.
okay, okay, yep.
So one of the big things that we would face is somebody would come from Minneapolis, let's say, to the Hudson Hospital
Mhm.
and present in the ER with suicidal or homicidal ideations.
Mhm.
They would call law enforcement, we'd have to go up there, do an assessment. Then we'd have to get county mental health involved to do another assessment
Mhm.
and then determine what we're gonna do. Are we gonna do a safety plan or is this gonna be a physical placement? Or is this not meet the criteria, are we gonna walk away?
Mhm.
Right? So what telehealth does is these people come into the ER to present, they get them directed to resources immediately.
Mm.
In most cases.
Mhm.
There's been a couple of cases that it's an emergency detention situation and they need to call law enforcement. We go up there and we deal with it.
Mhm.
In those cases, we may have to transport to Eau Claire,
Mhm.
Oshkosh. If we're super fortunate, there's beds available in the cities and we can jet them over there. But most cases, what they do is either a voluntary placement where they have a family member drive them to a different facility that's more capable of handling those
Mhm.
situations, like a Regions or United, St. Joe's, something like that. Or they develop a safety plan and they get them directed to resources the next day.
Mhm.
But the big thing that has helped is eliminating the need for law enforcement to be with these people for 6, 8, 10 hours to do an
Okay.
evaluation and a
Mhm.
medical clearance.
Okay, so if you are out on or your people are out on a call, and somebody presents with suicidal ideation, can you take them to the hospital here, or do you have to take them to Eau Claire?
We can,
I mean, to,
it's a little bit of a
Oshkosh.
dance
Uh-huh.
that you can do, because if we start the process through the county mental health system
Mhm.
at the person's residence or out in the
Mhm.
Walmart parking lot or something, we have to stay with that.
Okay,
So we're going to take them to the hospital for medical clearance, but telehealth is not going to jump in and pick it up. So it's all about how you kind of frame it. Hey, would you be willing to go to the hospital with me to get checked out, talk to somebody?
mm.
Then you can take them, telehealth will do an evaluation that way.
Okay, so they have to be willing.
It has to be voluntary for us to take them unless they meet the criteria for an emergency detention, where then we have to take them into physical custody, protective custody it's
Mhm.
called. And at that point, then now it's with the county systems,
Mhm.
and now using the telehealth system's not gonna work.
Okay.
But
Mhm.
I will say that, I mean, how many cases were presented, walk-in presents at the emergency department before telehealth that would end up in an emergency detention? Maybe half, I would say at least half of all emergency detentions that we dealt with, or even welfare checks,
Mhm.
right? Because that's a whole nother thing.
Yeah.
get called out as a welfare check to the emergency department because the doctor's just not sure and doesn't, you mean, you don't wanna let someone walk out and then they jump into traffic and kill themselves.
Mhm.
You don't wanna be
No.
the guy trying to sleep at night after that.
Mhm.
So a lot of our cases would be self-present at the hospital, and they come from all over the place, right? They come from River Falls. Why did you come here? Well, I didn't want to go to River Falls because I know people that work there.
Mhm.
And Baldwin, and Amory, and New Richmond, and, everywhere else, Osceola,
Mhm.
right? The cities.
Mhm.
We have a lot of people that have come from the metro area across the river to the Hudson Hospital because they know they need help, but they don't want to be judged,
Mhm.
right? We still have that stigma on mental health
Oh, yeah.
where people are afraid to be judged because they need help. So the telehealth has substantially benefited not only the patient, but our agency, our city, our department, EMS,
Mhm.
with that, because it removes us from a large part of that equation.
Okay. Mhm. Well, that's good.
It's the best way I can describe it.
I think the city of Woodbury has a job posting right now for a social worker.
Oh, there you
Probably
go.
the same. Be interesting to see how that plays out for them in the next year or so.
A similar program as this.
Yeah, I think it's the same concept that they're looking for. I don't know if the hours are the same, but we'll see.
Yeah.
how that
So we should
works.
keep an eye on that.
I'm thinking, back to the point by Chief Willems about connecting with the county. It would be, I don't know, personally, I think it would be interesting to kind of do a little bit of a dive in that.
Mm-hmm.
I'm wondering if we bring something like this to council just for discussion
Mm-hmm.
and potentially, I don't know if it's appointing one of us to sort of work with a county, do some research with that.
Mm-hmm.
Because I think you're right, Scott. This is something just at least talking about it and,
I think
who knows
even,
what the county would say.
I think if you even, my suggestion would be is maybe just start with talking to the county and understanding their resources.
Right.
And getting their opinion on what are their strengths and what are their weaknesses and specific to the city. And so really that'd be a good just jumping off point is get the information so you understand how they work and get their opinion on it and then maybe go back to the council and say, well, here's what they said.
Sounds
Here's what they're looking for, here's what could augment their services. And just as a liaison type and bring the information and go from there, I think is probably the best bet so that you understand, Jeff understands it. I've dealt with them intermittently. But so you understand it so you could articulate to the council their position and what they do. And then if there's needs or not, or then I think it would be good for the dialogue between the council and the county board to say, hey, how can we make this better for all? Our population base is here, but let's work together on making it better. You know what I mean?
Mhm.
Kind of like the library, working
So-
together.
So you could get this information ready for the next meeting?
I said council member.
I know. you did.
No, but I really think everybody has the same, there's nobody on, whether it's a county board, the city council, anywhere that's not gonna say we have an issue. But we're all just trying to figure out how can we make it better? At this point, they're the experts, so we should probably talk to them and get their opinion on what do they see, and then try to make it better. I mean, I think really everybody has to work together to try to make something happen.
What about
And that's really
inviting, who would direct the social workers at the county? Jeff, do you know?
Is whatever department
Is
oversees.
it public health?
Yeah, it's
Public health.
it's not public
Or
health,
is it
it's
law?
I don't know if it's Health and Human Services.
Oh, that
Oh.
sounds about right.
Yeah.
I think it's Health
Okay.
and Human Services.
Okay, and maybe what, the next step would be to invite someone from Health and Human Services to our next public safety committee meeting to give us a presentation or an overview of how they operate, so that we have some understanding, and then we bring up this issue and ask, how can we cooperate?
So are you saying you want me to invite someone to the next meeting?
Well,
What are you asking?
I'm
we're just-
thinking
we're
out loud.
Right, we're exploring what is the next
Sure.
step, right? I mean,
Well-
I threw out the council thing.
Yeah, I think Scott has a good point where you guys kind of, as council, right, need to kind of understand what is there already before we can try to
Yeah.
put things in place to try and make it better, right?
Maybe,
So-
Joyce, I think that's probably a really good start, is just, and tell them we need, maybe a 10-minute, here's what we would like to see. And I think going back 2 minutes to our conversation is exactly why we need to. We know if we need to call an ambulance, we call Lakeview, police, fire. But we are all somewhat stumped exactly who's in charge of this big issue we're talking about. So, I mean, I'm just being realistic. So
Yes.
have them here and say, you have like 10 or 15 minutes. Can you just tell us how it works? And then just go baby steps from there, try to understand where it fits in, whether it's the council and the county board or.
That's a good idea. That is a good idea.
Okay.
And I do think it's a great idea for Jeff to set it up.
Of course you do.
Good idea, Joyce.
Would you mind doing that, Jeff?
No, I can do that.
Okay.
Do we need a formal action on that?
I'll make the motion to
Just in case.
direct Jeff to invite the person who's in charge of social services to our next public safety committee meeting and give a short presentation on how they operate.
To the next council meeting?
No,
Next
public safety
public
committee.
safety. Yeah, keep it at the county committee. I'll second that
Okay,
level. All those in favor?
aye.
Aye. Opposed? Motion carries. All right, moving on down to F. I think we covered everything else so far. Severe weather siren previously located at 808 Hagan Street.
Yeah, so when they were here installing the new equipment, they did another sound study and they identified an old siren at the location of 808,
Who's they? I'm sorry.
Federal Signal and the other corporation that they remember, Bill's company.
Siren.
Yeah, some
Got it. Not
Federal
county,
signal.
but okay.
Federal Signal,
Got it.
private corporations, right?
Understood.
They identified an old siren that was located at 808 Hagan Street that had been decommissioned. It is no longer functioning, it's not connected to the current software or anything. Well, our coverage in that area is obviously lacking because there's no siren there. So I asked them to send me a quote for a replacement siren, and that's what you all have in front of you. I did go back, we are gonna have to meet, and I'm trying to get a meeting scheduled where they can come out and do another sound study because of the potential talks for annexation to the south of town. I wanna make sure if we put a new siren in, that it's gonna be adequate to cover any new areas that we might have, right? Because if we put it at Hagan Street and it's not gonna cover to, say, south of Rivercrest Elementary, then what's the point?
Right.
So if we could, there's apparently some elevation issues that snuffs out the sound between the Hagan Street area and the Rivercrest Elementary area. So I've asked them to come back to do another study to determine where the best placement to get adequate coverage south of that location would be. North of that location is adequately covered. So it's a matter of, if we're gonna put a new siren up to boast the coverage, then we should have it adequate for at least the foreseeable annexations that are coming into play. So that's in the process. I talked to you at a meeting, especially after the storms on,
Yeah, and I did have a
mid-September.
question about that, because I didn't, I woke up because of the whoosh coming through the windows, but I didn't hear a siren necessarily.
Yeah, well, that's funny. Some people in your neighborhood did, others didn't.
Right.
The sirens, from the way they've been described to me, are to warn people that are outside to take cover. So they're not necessarily designed to hear
Right.
inside your house. It's if you're outside your house that it's important for you to hear them, right? So, I mean, we'll be talking about this, to be honest with you, when something happens with the public safety building downtown is the location of our siren downtown. And we're gonna have to be talking about a new siren, because that one's what, circa 1942?
Yeah, I've had this discussion with Mike Johnson and Aaron Reeves also that it's really old, needs replaced. They have located a spot in the parking lot of the city hall, but also that I've kind of been proactive with, they need to, with the redevelopment of that, obviously they're not cheap. I think they should try to figure that into the redevelopment cost, that it needs to be done at that time to move it and make sure that that doesn't get lost where they sell the building and then we have to bear the cost of the
No,
moving
so
and that.
now we're looking at $22,000 out of our.
Well, and that one's probably the post and everything else is, so, but it's really old, so it
is old.
needs to be replaced, so it can't be moved.
How many sirens do we have and where are the locations?
Oh, we have the one on 8th Street. We have the one downtown. We have the one up in White Camp. Is there only 3 right now in the city?
Oh, it should be 4, the other one was, I think we have at least 4.
I think we have 4. I don't know
Oh,
where the
but-
location of the other one.
This
And
is-
then this
Was there
a-
one near the high
This was
school?
a 5th one. Yes, there is. It's right
Yeah.
behind the high school.
Okay,
Right
that's what I
behind the track there.
okay,
So that's the 4th one. The 5th one was this one that was decommissioned.
okay.
But that's what we have right now is 4. I'd be looking to add another one,
Mm-hmm.
and then that should keep us pretty adequate for a while. So the reason it's here is because I talked about it with Bill after the severe weather that we had.
Mm-hmm.
I said I have a quote for one. I haven't been able to figure out the best location for it yet, and I'm still working on figuring
Okay.
that out because I don't have the equipment to do it, nor the know-how. So.
So you want us to approve the sound study and purchase of siren equipment? That's what it says on the
Yes.
issue sheet. So, where would the money come from for the equipment?
No idea. Emergency management has no budget, so.
Okay,
That's something that we would probably have to bring up in finance.
yeah.
But I don't know if there's a recommendation that we could make from here where it would come from.
Do we need to first get the information on where we're gonna put it, or do we need to send it to finance committee first?
Well, I mean, I don't know how long it's gonna take to find out where to put it.
Yeah.
You know, I'm
Okay.
working on their timeline,
Mm-hmm,
Sure.
and I have no idea when that is. I mean, sometimes it takes me 3 weeks to even hear from these guys.
Because again, it goes back to the study.
It goes back to the study. So, I mean, my opinion would be to figure out where we're gonna get the money from to do this and approve that.
okay,
And then
Gotcha.
once I have all the other information, I can come back and say, hey, here's the proposed location. You've already approved the funding for the purchase. Can
Okay.
we go ahead with the purchase kind of thing? I think it makes it easier if we find the money first.
yes, okay.
And then
It-
figure out where it goes later.
Is there a charge for the sound study?
We weren't charged for the sound study on the first one.
Yeah,
I think that's just part of what they do.
What they
That's
do,
their
sure.
service, okay. All right, I'll, make the motion then to, send this to the finance committee to determine where to, how to pay for it.
And we can have that conversation then.
Yeah.
I'll second.
The same, you guys can think about it for the next, 2 weeks.
I'll second, so, all those in favor?
Hi,
Aye. Opposed? Motion carries.
I thought
I'll see
the
the
purpose
next-
of the sirens were so you go outside and look for the tornado.
No. That's what a lot of people do though. A lot of people too, especially in this area, are still confused that they hear the sirens, they think it's a tornado warning. But St. Croix County tones the sirens for severe thunderstorm
Severe
warning,
thunderstorms. Yeah.
which for obvious reasons, right, you have a severe thunderstorm warning that could spawn a tornado.
Mhm.
And by the time it reaches St. Croix County, it's in Hudson, so
Yeah.
it's a little late. So I think that's the brainchild behind the,
But you bring up a good point, because those are county set, not city set.
they are toned out through dispatch. So when the National Weather Service issues an alert, it goes right to dispatch, and then dispatch puts that information out. So if it's a severe weather alert, they set off our sirens. Now, we have the capability to do it manually here,
Mhm.
but if something were to happen at the dispatch level, we can come, the equipment is housed here in the fire department, we can come up here and tone those off.
Because what I've heard from neighbors is it seems like there's a little bit more warnings than not, more sirens going off but because of that whole point, that it's about the severe weather.
It's about the severe weather warning. It's not necessarily just a tornado siren.
Right.
It's a severe weather siren.
So, when the siren goes off, what's the best source of information on what the siren is telling us?
Well, there's apps on your phones. There's weather radio apps that you can
Okay.
do. The television, if you have cable.
Mm-hmm.
Obviously, if you lose power, you're in trouble. So a weather radio, the actual weather radios that you can do, there's the
Okay.
weather radio apps. That's what woke me up on September 17th was the weather radio app.
Okay,
It's a big buzzer that goes off, and then you look, and it's severe weather headed to your area. Otherwise, your local news, radio, the weather radio, or
Okay.
the radio station, they all broadcast that information. When the National Weather Service issues an alert, they send it to everybody. So then it's up to those media outlets to get it out.
okay. Mm-hmm. Thank you.
All right. Informational items, Hudson Police Department pursuit policy. I know you touched on it a little bit earlier. If you
Yep.
could just kind of give us the.
Sure. So last spring, actually last fall, Minnesota changed some of their use of force laws, right, as it regards to law enforcement, which basically say you, as an officer, have to be able to articulate the intent of a person before you use any kind of deadly force against them. So it's not enough that they have a weapon and they're not complying with your order to drop it. They have to point it at you, and you have to be able to articulate they have an intent to shoot you before you can, for lack of a better term, shoot them. So it puts you behind the eight ball from the beginning as a law enforcement officer. There has to be an active, declarable threat for you to engage, right? So we spent some time going to Minnesota and talking to them about what that means with their attorney general and their county attorneys, explaining their idea of the law as it's written.
When you say we, I'm sorry to interrupt, but.
Myself, other chiefs from the area, the
Got it.
sheriff,
Sheriff, okay.
right?
Yep.
To determine how is this going to affect us, because we do have standing mutual aid agreements in place with Washington County, with Stillwater Police Department, right? So it's going to affect our response depending on what that response is to go over there. So we wanted to understand what this meant for us. And the way the Attorney General of Minnesota described it to us was that if a law enforcement officer gets called to a home where a man slaughtered his wife and two kids in a stabbing and called to turn himself in, and law enforcement arrives on scene, and he stands up from the porch with the knife and takes off running into the woods, you are not allowed to engage that subject. Because you don't know, just because he killed 3 people, that he's going to try and hurt somebody else. That's a problem. That's a problem from a public safety perspective. That needs some immediate intervention. Now, I'm not saying that you're just gonna start unleashing the fury on that person, but there's some kind of intervention that needs to happen there. And if the law enforcement officer tries to intervene, and that creates a deadly force threat to that officer can be charged if he uses deadly force. Which to me is kind of backwards. And they're talking second-degree homicide. And I don't want my officers to be in that position, that if they're doing something that they've been trained their entire career to do for the right reasons, to be held to an unreasonable standard. So I made the decision that I was going to tell my officers that they are not going to chase anybody into Minnesota for those reasons. We generally only chase for violent felonies. You know, a taillight out and they don't want to stop for the police, okay, we'll get you some other time, right? But if you just committed a homicide or you just committed an armed robbery or something to that effect that is a violent felony, we're going to chase you because we think it's that important that we catch you from a public safety perspective. But if you go into Minnesota and for some reason one of our officers uses deadly force against you, we're held to that standard as opposed to the Wisconsin standard, which is clearly defined in statute, which kind of sets them up for failure. We're not trained in the Minnesota law. We don't train that way. And even there in Minnesota, we're trying to figure out how are we going to retrain our officers with 10, 15, 20 years, 25 years on the job doing it the same way, because pretty much nationwide, we've all done it the same way. There's federal case law that backs it. There's, years and years and years of history that has shaped modern law enforcement into what it is today. And then to have one state government say, none of that stuff applies anymore, you need to follow this, and not having been properly trained in it, it's a recipe for a disaster. And I wasn't gonna have my officers be a part of that. So we are still responding in mutual aid requests, but a very narrow response of what our officers are allowed to do or not do.
Can I ask a question?
Yeah.
In that scenario, if something happens and you're not pursuing, is there some sort of handoff that happens with anybody on the Minnesota side?
Yep.
Okay.
We notify them through our dispatch center, notify the Minnesota State Patrol in Woodbury and Washington County Sheriff's Office that this is what we had, this is what happened,
Gotcha.
this is the last.
So it's
place we've
not
seen
that
it.
you, yeah, okay,
Yeah, it's not, we don't just turn around and say, oh, whatever, no.
right.
We do provide the information to the agencies that they're headed toward.
Sure. How did just out of curiosity, how did the other chiefs react to this sheriff's department? Are they making similar?
In a very similar fashion, right? It really affected Prescott, us,
Right,
St. Croix and Pierce County Sheriff's Offices.
sure.
But New Richmond was there, River Falls was there, North Hudson was there. North Hudson's got a very similar policy. Shouldn't call it a policy because we didn't physically change the written policy. It was a directive by me, because if that law fails,
Right.
and it comes back to normal, then I just take away the directive, right? We don't have to go back and it's kind of a process to change the policy. So
Thank you.
Is there any litigation over this law at this time?
not that I'm aware of yet, but I anticipate that's just a matter of time.
Okay, thank you.
Thanks, Chief. Any other questions about that? Okay. EMS, fire, and police updates. I guess we'll start with you, John.
For August, we had a total of 112 calls in the city of Hudson. Compared to last year, 2020, we had 106. For overall service response for August, we had 1,055 calls we responded to. In the city of Hudson, 78 of those were lights and siren response, 34 were not. We had an average response time of 3.44 seconds, and 90th percentile, we were at 6.45. We had no mutual aid requests in the city of Hudson in August. There was one public safety standby event, and we provided 9 mutual aid responses to other EMS agencies in the area. And then in September, our calls were 116 calls in the city. In 2020, we had 105 calls. Lights and sirens, 77 of those calls were lights and siren response, 39 were not. And we had an average response of 3.48 and 90th percentile at 6 minutes. No mutual aid, and we provided 18 mutual aid calls in September for other services. Department updates. Our 6th ambulance is not fully operational yet. It's still, we're still in the hiring process, and things have changed a lot in a year. We've made 5 job offers. 5 job offers were accepted, and then someone else outbid us or whatever. So we got 1 more position left to fill before that's completely full. And we have 2 people in their FTO training. So we need 3 for that position. So it's an open free-for-all for overtime. Like today is one of the days it's filled, so the truck's on the road today, and they've been busy. So we like the days that we have it filled, but like on the weekends when we really want it filled, people don't want to work. I mean, our crews are really tired. It's been very busy. So we continue to work on that. We are continuing our bonus pay. We implemented that bonus pay, I think, back in June, May or June, with the anticipation that we would do it through the summer and get through it, but still trying to fill these positions. We are paying out a lot of bonus, and it's helped. But I think that only goes so far, and then people decide, you know, I want to have a life too. But so far, it's working for us. We're moving to our new base next week. So on the 15th, we'll be completely out of the hospital and at our new temporary location, which is the old Denny Hecker car dealership, which is now owned by Fury Motors, right on Highway 36 in Greeley.
Is that where the COVID testing?
Yep.
Okay.
Yeah. So we put a ton of money into that to bring that building up to code, so that our crews can be there 24/7. Unfortunately, we had no choice, so I don't know if I said this before, but the reason we're moving out of the hospital, number one, we outgrew that 10 years ago, but number 2, they're putting in a cath lab in our space. So the hope is that cath lab will be operational by second quarter of 2022 and seeing patients. And then we continue to work on our plans for our new base, which will be in Stillwater, behind the Stillwater Medical Group. So.
And I want to just clarify for the public knowledge,
Yeah.
you're talking about, again, Lakeview Hospital. This is not
Correct.
Hudson Hospital.
Lakeview Hospital.
Mhm.
Our base is still here. Actually, the plans for the base that we built here is what we are going off of. This will be much bigger. Will be our main operation there, so. And I guess just kind of for your information, the hospitals everywhere are completely full. It's not all just COVID patients. I think it's a combination of people did not go seek medical care during COVID, and now things have gotten worse, and where the acuity of patients we're seeing is much higher than we're used to, and the hospitals are really stressing right now. One other thing I should mention, there's been a lot of talk about the healthcare providers and the healthcare organizations mandating the COVID vaccines. And we are one of those healthcare providers that it is, if you don't get the COVID vaccine, then you can't work there anymore. So in our department, all of our staff now, I reported earlier that we had 2 people that didn't get vaccinated, but now all of our staff are 100% vaccinated.
Are
So
they
that's
getting
good for
back
us.
boosters now?
Yep, we're getting started boosters. It was either this on Monday or maybe on Thursday or Friday last week, but whatever day they announced it, we started giving it, so.
Can I jump in before I forget?
Absolutely.
Do you know, because I just read the study yesterday that says 6 months after your vaccine, the effectiveness tumbles. That's the point of the booster.
Yeah.
Do we know what the length of time the booster is supposed to be effective for?
I haven't heard.
I'm sure they don't know yet,
Right.
right?
Yeah, I think it's all, I mean, there's a lot of science behind it, but I don't know, and everyone's different too. What they do know is the people that have been vaccinated, even if they're at that later end of their vaccination, meaning months, I had it months ago, they're doing way better than the people that are not vaccinated.
Mm.
So it's, I don't know if you saw in the news, Alaska is, they're worst they've ever been. The deaths are going through the roof, and healthcare workers are really, really tired. They have no hospital beds available, so we're feeling the pain here as well with the no hospital beds available, so. But any questions at all?
Yeah,
Yes.
last time, you gave an update, you talked about ambulance maintenance and that it was really hard to, get the chassis.
Yeah.
How's that going?
So I was told we received our two chassis for our rebuilt a month ago, and then I called today just to see where we're at with our rebuilds, and he said, well, I lied to you, I didn't get your chassis, they're still at Ford. I'm like, well, how does that happen? But anyway, so he claims that one is in production, and I said, so tell me what that means. That means when it comes off the assembly line, we're still waiting for a chip from China, so he'll sit there. He said, no, they have the chips for these chassis, but why don't they have them for others? So I don't know how that, you play the game, I guess. And then we already have the funding for 2 new ambulances that was we got that funding from donations, so if that's a year, that will take a year. So that order's been somewhat placed. I'm waiting for them to give me a quote so I can actually officially stamp it, so.
Okay.
But no, we're praying every day our trucks hold out. They're moving a lot, so.
Thank you.
Mhm.
Chief Phillips?
Just a hiring update. So we're hiring. We're working on setting up interviews actually for, was that next week already or the week after? Next week already. We had a process that was open for about 2 months. We only got 31 applications, which, to be honest with you, is a little higher than I thought we would do, but it's about 50% down from what we're used to. So that's been good. But we are trying to hire. We had the new position that was created. We had one officer resign to go back home to the east side of the state, take care of family, and then we had one officer retire. So we're doing a list to essentially hire those positions and backfill. So it's really the only update I have, other than this mask mandate is going to prove to be very challenging for my department. You don't realize it when you're just sitting in a meeting. Well, it's no big deal. It's just one building. But I essentially have to provide security for that building almost 24 hours a day, with all the meetings and things that are happening. So we'll get there. It's just,
Okay. Well, let's see how things work.
It's a challenge.
Okay, I appreciate the work, and I'll be anxious to hear the report on it at the next meeting.
Well, you'll see it.
Yeah, I know, you'll
You'll see it.
Thanks, Chief.
Yep.
Chief St. Martin?
Just briefly, we had the open house. I thought it was very successful. Thank you for showing up.
Well, thanks for the
Council
ride.
member, the public safety council members all showed up. Councilmember Morissette, Hall, and Alms, we appreciate it. The feedback was very positive.
Oh, my granddaughter loved it.
Yeah, it just seemed that the weather cooperated, everything was
Yes.
great. We had some sponsors that helped with some of the food and some of the shirts, and that was Rosenbauer Corporation, Creative Homes, and then EJ's Pizza and Cozy Corner, so I'd like to thank them for contributing. It made it a success. And then all the firefighters and some of the family helped out a lot too, so it was good. One other thing we did recently, public safety was at the, a meeting the other day of the Chamber of Commerce, and I think that went well. It was nice to see everybody there, and it's kind of fun sometimes to interact with the business community and just get their feelings on and kind of talk back and forth with what their expectations are and how they feel. So that was, personally, I think that went well. Plus, they had really good cinnamon rolls. So.
And you were the chief of police. For that,
Yeah,
right?
yeah.
You got
I feel bad. That was not Jeff didn't like that because he's much younger and better looking than me. So.
Well, younger anyway.
Back on one thing we've talked about. I think I've sent a couple emails to the council about is the turnout gear. We only have one set, and we had another fire again, and it's kind of the same thing. While they're cleaning it with all the cancer awareness, our crews who are there don't have turnout gear. If we get another run with that, and that's where I feel strongly about getting a set, and it does qualify underneath the ELPA, and I continue that consideration. I know they're not ready yet, but we haven't officially talked about ELPA, but it seems to come up at every meeting we're at, except we don't officially talk about it. But when that comes around, I'm going to push hard for that because I think it's a big safety thing for our firefighters, and I'm going to stand strong on that, and hopefully we'll see that we can get some resolve. And I have sent letters to our other neighboring communities too to let them know they may be possibly involved or asked to be involved. So,
question about that, Chief. Do you see it as an urgent need?
yes.
More urgent than waiting for
Yes,
these
and
funds?
I think that the funds we can do, I mean, I think it's going to be either that or we're going to put it in. I talked to the administrator about putting into the budget for next year, but we felt comfortable it falls into this ELPA. So that's where we're hoping to get it and one way or the other. But I from the last meeting from Mr. Reeves seems to think within a month or so we should have some. Part of that is from what I understand is we already do because of the COVID and the need of the cleaning of the gear just from those exposures. We fall under that right now. So I think what they're looking for is more clarity on things that may be fringe. Ultimately, it's up to the council and that to decide if they want to go this route or not. But all of my research has shown that we are okay for that. And there's a lot of things that are. I think it's just everybody has some request, and I think it's just a matter of Mr. Reeves wants to make sure we vet everything, because if something's not eligible, it probably won't make it to that table to consider. So
I just don't want to wait on a safety matter, if,
Mhm.
you know.
So
Employee safety is important.
yeah. So other than that, you'll hear me on that. Otherwise, it's been fairly busy. Just kind of keep going. Our staffing is at a decent level, and we may look next year to possibly put a few people on, but we're just kind of keep working, and then hopefully this COVID and stuff straightens out.
I love that open house a lot. I was just curious if that's going to become an annual event, perhaps.
Well, we've had for fire prevention, yes, we started a few years ago on having it, and then so I would anticipate next year it'll probably be during Fire Safety Week and that, so Fire Prevention Week.
Great.
Is that in May?
October, it's coming now. Yeah, it's now.
Any question for Chief? All right, thanks all. And with that, I'll entertain a motion.
Move to adjourn.
Second, all those in favor?
Aye.
Aye. Opposed? We stand adjourned.
Okay. Have a
Thanks,
good night,
everybody.
everybody.